Hello, and thank you for joining me today. I'm excited to show you how Google AI can help improve quality of life for communities by creating timely, insightful, and actionable community health needs assessments, or CHNAs. A CHNA is a systematic process used to identify and understand the health needs within a specific community. It is critical because understanding a community's health status, determined by a mix of economic, social, and health factors, is key to improving residents' quality of life. It helps us see where resources are accessible and where services are lacking. Public health departments, nonprofit hospitals, and other organizations benefit greatly from this data. As an example, I will show you how an AI powered CHNA 2.0 was created for the city of Dearborn, Michigan. Let's start by looking at a sample report. This was generated for the city of Dearborn. It includes information on community definition, health outcomes, community input, access to healthcare, and social determinants of health. It is an assessment of the community's health landscape and highlights key areas for improvement. If I scroll down, you can see that it includes key findings like population distribution across neighborhoods, more information on population distribution here. It has information on cancer rates, which you see from this heat map, and it also has other chronic illness rates highlighted. It also summarizes community input using news, social media, as well as Google Trends. This information helps to identify health needs at both the neighborhood and community level, as well as comparing it to the state. So, traditionally, creating a report like this has involved a very manual and resource intensive process. The current community health data gathering is a very manual cleaning and analysis process. There are many sources that take a long time to create. The data gathering is done manually but is typically limited to surveys, census, and some health outcome data. While the process is slow, the reports are often updated once every 3 years. So when new public health priorities emerge, the data and insights are out of date, making it difficult to respond or make informed decisions. Syntasa, in collaboration with Google, is changing this. We have developed a solution that leverages the power of data analytics and generative AI to streamline and enhance the CHNA process. We collect and clean data from various public and private sources and use Vertex AI to gain insights into community health needs. We also utilize generative AI to suggest the first draft of the report. This can be seen here with an architecture of the CHNA pilot we did. So for this project, we collected data from Dearborn's incident response, public health outcomes from the Phoenix Data Hub at Wayne State University, search trends from Google, social media, and census data. And we also planned to include survey data, but it was not available at that time. We created dashboards and visualization panels in Google Looker to best illustrate the public health situation. Then we used AI to generate content for the CHNA report, which were then reviewed and curated by human experts. If I move to our software solution, you can see that our software consolidates necessary data pipelines and then performs topic modeling, trend exploration, and categorization. This powers our dashboards as well as the AI-driven analysis. Now to go through some of the dashboards. As seen earlier in the report and seen over here in Google Looker, we can start exploring some dashboards. The first one starts with population density, which shows Fort and West has high population per square mile. You can see other demographic information like median age and female population. This sets a good baseline to do any analysis. If I go into an illness heat map, you will notice that we can load it by different diseases. This map is talking about the cancer rate and showing the geographical distribution of how many people who have cancer and need immediate attention. We can also see that these dashboards can be updated to look at other diseases like chronic obstructive pulmonary disease. And you can see over here that Selena has more incidences of this than it does for cancer. Similarly, we can look at the rate of asthma in Michigan. There's further analysis done for chronic illnesses, comparing it to the state levels. It's easy to see through this analysis that pulmonary disease in the city of Dearborn is at a higher proportion than Michigan. This helps us understand potential environmental or socioeconomic factors that could influence cancer risk or COPD risk or asthma risk and informs targeted public health interventions. Now, if I go to a different kind of dashboard where we have a city view, this dashboard leverages Google search data to indicate community interest. Give it some time to load. Here we go. Um, this community interest, this is a well-supported approach. While this data is publicly available, we have developed a method for advanced querying and analytics that provides broader insights for a specific community. It signals the topics that are most important to the community in a timely way. For instance, the most popular searches in Dearborn during the pilot focused on childbirth and diabetes, while Detroit was focused on hospitals. Ann Arbor, a university town, showed interest related to college, birth control, and mental disorders. Insights like this can indicate a need to improve public awareness and access to healthcare. We can also see over here search activity rising and falling based on every single city. If we go back to the report, you can see that the data on all these dashboards was actually consolidated using generative AI to create descriptions for each dashboard panel and a first draft of this report for human expert review. Our solution incorporates the latest data to provide timely insights, and generative AI creates the draft reports faster. This allows public health professionals to be more responsive and effective. Overdose calls by month shown here in the report can be very important to assess when thinking about actions needed in community health centers. If I go back to our platform, you can get a good sense of how configurable it is to actually work with all this data, as well as get a preview of the information that we are collecting from all the data sources. The solution uses readily available public data and employs advanced analytics to give everyone insights. Now, in summary, Syntasa's CHNA solution offers a powerful new approach to understand and address community health needs. It provides timely insights and fast report generation. The AI capabilities in Google Cloud allow public health officials to spend more time serving their communities and less time collecting and analyzing data. Thank you for your time. It was a pleasure sharing this work with you, and please contact us if you'd like to learn more.